due to the nature of their work, are also equally frontline workers. All emergency service providers will be in that category. Inclusive of them will be our teachers, because as you know, we have resumed learning, and our teachers are equally just as exposed, as we also move to those who have comorbidities and those above the age of 58, as we move to the rest of the population. So I would really plead with you to stop any kind of insinuation that may create dissatisfaction amongst your people. This is a time for us to come together and ensure that we are able to provide this much needed service, this much needed vaccine to our people. And we will walk that journey with you. As far as we are concerned in government, ours is to help these wonderful people who work day and night to ensure that we support them with logistics, that we support them to ensure that they are able to get the vaccine out, that we support them to ensure that we have enough doses to cover our population so that the exercise is continuous until such time as we have completely vaccinated our people, or at least have been able to achieve what we have been told is referred to as herd immunity. But it will be their responsibility. They are the experts, they are the ones who will guide us. And if you have any questions outside of policy, which I have just detailed out to you of how this vaccine will be rolled out, that is policy. With regard to the execution and how it will be done, ask the professionals, ask the technicians, because it is in their hands. They are the ones who will be in a position to guide and to tell you how many doses have been distributed, to what part of the country, how many people have been vaccinated, how many health workers have been vaccinated, how many policemen and security men have been vaccinated, firemen, all these frontline workers, how many teachers, and so on and so forth. So that we are able to report factually. We have nothing to hide. We want to report factually. But that is not made easier when people depend on rumors. The professionals are here. Huyu ndio mwenye kiwanja. Ukiwa na maswali, ofisi yake ni hapa, jamani, njooni muulize. Wapi amo huyu mwingine? Mkiwa na swali, muulize. Sisi mtuulize policy. Na policy I have just detailed out to you the policy that we are planned to utilize. The work will be done by these people, and ask them. They are available to you to answer whatever questions that you may have. Sini namna hiyo wenzangu. Na ndio tuweze tusaidiane pamoja na tuhakikishe ya kwamba tumesaidia taifa letu na tumesaidia wananchi wetu. Sisi tutaendelea, and I cannot but once again re-emphasize that despite the fact that the vaccine has arrived and will continue, because we will get more and more doses until we meet our requirement, that does not remove from every single citizen the obligation and the duty to continue to maintain the health protocols that we have been given by our doctors, by our experts. We must continue with face mask wearing. We must continue with hand washing and sanitizing. We must continue with social distancing, because ultimately these are the factors that shall ensure that we are able to combat and defeat this deadly virus that has infected the globe and that has resulted in a huge social as well as economic crisis that is global. So let us continue to work together and partner together, while I once again say thank you very much to all those who are concerned with this particular process, and once again also to thank all Kenyans, wherever they may be, for the manner in which we have worked together hand in hand to be able to ensure that the level of death and the level of loss of life and illness has been maintained. We have had it, yes, but it could have been much worse had it not been for the manner in which our population, our health experts, and everybody have worked hand in hand in order for us to ensure that we have minimized the impact of this virus as we steadily and slowly move towards the reopening of our society, our economy, and to get back to as normal as we possibly can, building back better for a better, brighter future for all of us. I will answer 3 questions and only 3. Right, you're there?
My name is Sarah Kumani from the South African Broadcasting Corporation.
Yes.
Now, if it was not for COVAX, we are the 4th African country to receive these vaccines. If it was not for COVAX, we probably would have had to wait a little longer. What is your message to the international community in regards to vaccine nationalism and in regards to how other countries are prioritized in terms of getting these vaccines?
I have 3 points to say on that. The first is that vaccine nationalism is something that we should all hope. We are very clear, and I think, if you ask any expert, there is no single country that will be able to be safe unless all of us are safe. So we all have an obligation to ensure that this vaccine is made available as widely, as cheaply, and as quickly as possible to all citizens of the globe. Secondly, I also want to take this opportunity because last year, as the process of vaccine development was going on, we ourselves as an African Union. Last year, as the process of vaccine development was going on, we ourselves as an African Union, and in particular, the Bureau of the African Union, of which I was a member, chaired by the South African President, Cyril Ramaphosa, we took a decision that we are also not going to sit back and wait until such time that a vaccine has been discovered. We will also begin a proactive process of ensuring that this vaccine is also going to be able to be available to people across the continent. And in fact, I am happy to say, as a result of that initiative, we are standing here today barely a few weeks after the most developed countries and beginning our own process of vaccination, whereas previously we would probably have had to wait for years and years while the rest of the world was moving ahead. But this time round, because of the proactive nature that we adopted, because of working together as an African continent, we are barely weeks behind the rest of the world. And I think this is the spirit that we in Africa must continue to adopt until we overcome this disease, but even as we face other challenges as we move forward. And I also once again would like to say I am thanking all those partners who have supported not only Kenya, but the African continent in this particular process. All right, one on this side, and then I finish last one on that side.
Za mchana, jina langu ni Kazo Gunga kutoka runinga ya Citizen. Pengine tu kuuliza, taifa letu ndio tumeanza kupeana chanjo, lakini ukiangalia taifa la Tanzania ambalo ni jirani yetu, hawajatilia mkazo sana masuala ya corona. Je, ni vipi ambavyo tahakikishia Wakenya kwamba watakuwa wamekingwa na chanjo hii licha ya kwamba mataifa mengine jirani hayajatilia mkazo swala la corona, na pengine kama kuna maongezi ya kuona kwamba taifa la Tanzania linatilia mkazo ili kulinda Wakenya kwa ujumla?
Mimi singependa kuongea juu ya vile nchi zingine zinajiandaa ama vile wamejipanga kupambana na huu ugonjwa. Nimesema nikijibu dada yetu kutoka South African Broadcasting ya kwamba tumeungana sisi kama muungano ya mataifa ya Afrika AU kuona vile tutasaidiana pamoja kupambana na huu ugonjwa. Na tutaendelea hivyo. Na tutaendelea kuhimizia wananchi wetu wa Kenya ya kwamba huu ugonjwa ni hatari na ni ugonjwa ambao unachukua maisha, na ombi letu ni ya kwamba wenzetu wote watafuata huo mwongozo. Kwa hivyo mimi sitaki kusema juu ya vile mwingine atafanya. Kila nchi iko na serikali yake na uongozi wake. Watawaambia nyinyi wenyewe mipangilio ile wako naye kuhusu nchi zao. Yangu ile nimetangaza leo ni ile mipangilio tuko naye kuhusu nchi yetu ya Kenya, na hiyo nimewaeleza na kusema ya kwamba tuko tayari kuendelea kufanya kazi na wenzetu wa Afrika na wenzetu wa dunia kuhakikisha ya kwamba sisi zote tumejiepuka na tumejikinga na tumejilinda na tumeondoa huu ugonjwa kati yetu. Last one.
Good afternoon, Mr. President. My name is Eunice Omolo from NTV.
Yeah.
I have a question.
Yeah.
When are you and other leaders going to lead by example and get the jab? And then number two, you've said that the first batch, it didn't cost Kenya a thing. So do we have plans of purchasing extra vaccines in order to cater for the population?
Let me start with your second one. Yes, of course, because the vaccines that are here are not enough. And I think, if I am not wrong, we are expecting another batch in?
Yeah, at the end of April.
End of March.
Yeah, end of March towards April.
End of March, April, we're expecting another batch. So we will continue to receive the vaccine until all our people are effectively covered across the country. With regard to whether we will lead by example, these are the people who will tell us. I told you, we have a policy. Yeah? The same person who is saying, ukiona nikichanjwa, munasema, wakubwa wameenda kuchanjwa. Huko. Hiyo mdomo yako ndio itasema tu hiyo. Kwa hivyo, hawa wakituambia ya kwamba this is the way, they will tell us and we will follow. Like I said, ours is the policy. The policy is clear. If the professionals tell us this is the way and this is what we need to do in order for ABCD to lead by example, they will tell us, and we will abide by the directions that we are given by our health experts. They are the ones who will tell us. But as of now, mine is to give you the policy. The details of how it shall be implemented, the professionals will be the ones to respond to that question. Last one.
Thank you, sir. My name is Purity Museo from Kenya Broadcasting Corporation. My question is, as President and Kenya, is there a target in regard to, or in terms of the number of people that Kenya need or hopes to vaccinate before the end of the year?
Again, I don't think I am in a position to answer that technical. Amos kuja hapa, shika.
Thank you, Your Excellency. We are going to roll out the vaccination in phases. Between now and 30th of June, we target to vaccinate 1.25 million people, as clearly illustrated by His Excellency the President. Oh, thank you. We are doing the vaccination in phases. Phase 1, which starts from now until 30th of June, targets 1.25 million Kenyans, and then phase 2 will commence thereafter to target about 9.6 million Kenyans. Thank you.
Si tumemaliza? Okay, two more. Ndio msiseme nilitoroka. Sikusikia.
Mr. President, good afternoon.
Afternoon.
My name is Ben Kirera from K24 Television, and my question is, even before Kenya was planning to, purchase the vaccines, we still had our very own process of developing our very own vaccine in Kilifi. Just like to know, just to confirm, how far are we with that particular development? Thank you.
Let me just say what I know.
we were partnering in terms of going through the what is it called, the clinical trials, and that is what we have been partnering with, and we will continue to partner with international organizations towards that. And ultimately, as I said when I was meeting diplomats earlier, I was congratulating. It is not to say that hopefully our own scientists and researchers cannot also come up with something. We will continue to encourage our own local researchers and scientists to come up also with vaccines or new innovations that can help us combat this disease. But as of now, we will continue to partner with our international partners in terms of clinical trials and etc. to establish efficacy and other such issues. Last one.
My name is Elizabeth Kivuva from Business Daily Nation. The information that you have received from Health Ministry is for the last category can receive their vaccine in 2023, which seems to be a long period of time. I just wanted to know whether there is a plan maybe to involve the private players in maybe shipping and maybe bringing in some vaccines.
Again, that's you can answer that. Me, I can't.
This is better. Thank you, sir. As you lightly said, Your Excellency, some of these discussions about how we are going to do it and the rollout thereof is also dependent on the supply chain and where and how quickly we can get the vaccines from the suppliers. Because let's not forget that the reason why we can't roll out everything immediately has also got something to do with the fact that we cannot get enough vaccines. So what we are doing at the ministry is planning to acquire as quickly as possible and going forward to see how soon we can go into the rest of the population. But at the extreme side, if you look at the plans, even places like Europe, there are those planning all the way up to 2023 and so on. So if we can get them faster, we will do it a lot faster than the predictions that have been made. And Your Excellency, among the people who are dealing with this issue is Dr. Willie Zakwale, who is the one who has been handling the whole chain of where we are getting and how we are moving and how we are going to vaccinate people and the entire safety of everything. And therefore, Your Excellency, there is a good plan. The fact that we have told you that it will take about 2 years simply means that that is what the supply chain is predicting. But of course, if we can do it faster, then we'll do it a lot faster. And then let's not also forget that once we have vaccinated the very vulnerable groups, then the rate of infections would essentially start dropping. And as we go on, for example, sir, we are also expecting some vaccines that will only be 1 dose instead of 2 doses. So the progress in the industry will also determine the speed at which we are able to execute this particular responsibility.
Thank you very much. Nafikiri tumemalizia hapo. I said 3 and I've done more. I think it's fair. Just to once again, I thank all these wonderful people for their continued hard work and everything that they continue doing. I want to, again,